This video has been prepared for the unit leaders who manage clinical alerts at the William Osler Health System. There are a few important points to mention about your responsibility as a charge nurse managing clinical notifications. The device must be carried at all times. As the unit leader, you are responsible for responding to the clinical alerts promptly. Your unit should develop a device charging schedule to ensure that the device is always sufficiently charged. Your device will be passcode protected. The device carries confidential patient information, and this information must be safeguarded. You will be required to enter a 4-digit passcode to open the device. The cost of replacement for any damaged, lost, or stolen devices will be the responsibility of your unit. Do not leave your device where it could possibly get stolen. Your device is password protected. You will need to enter the 4-digit passcode provided specifically for your device. Once you have done this, you will be brought to the home screen, which is shown on the right side of your monitor. Note the Engage app icon in the bottom right-hand corner. You may experience a time when you get logged out of the Engage app. You will need to enter a username and password to log back in. This information is in the front page of your clinical alert binder. When you receive a clinical alert, you will see a notification message on your home screen. The notification message, along with a specific designated alert tone, will notify you of an incoming clinical alert. This example shows a TOA alert, which is designated as a medium priority. This is a medium priority alert tone.
Advisory alarm.
The transfer of accountability process begins when an alert is received by the ER charge nurse. The alert is triggered when an in-progress bed clean is started on a reserved bed. The ER charge nurse will notify the primary nurse to start the TOA in Meditech. When the TOA is complete, the primary nurse will enter a task to call the porter. On the inpatient unit, the charge nurse receives an alert telling them that the TOA has been completed. The charge nurse will notify the primary nurse that the TOA is complete. The primary nurse is required to complete the acknowledgement section of the TOA. If any clarification is required, the primary nurse will call the ED nurse. When you receive a clinical alert, they will stack on the home page based on their priority. Alerts are classified as high, medium, and low priority. High priority alerts always stack at the top of the screen and are identified by a red triangle. Medium alerts are identified by an orange square, which stack next, and low priority alerts identified by a yellow circle stack at the bottom. Any secure text messages will be seen at the bottom of the screen and identified by a blue icon. Each category of priority alerts will have a different alert tone assigned. To open the alert to get more detailed information, you will need to click on the right arrow to open up each alert. The alerts will stay on the device for 1 to 2 hours, depending on the alert type. The information screen shows the alert type, ER location, admitting location, the time of the alert, the patient's name, physician, and number of times the alert has re-alarmed. You will be required to accept the alert. If you do not accept it, it will continue to re-alarm. There is a new feature within this app that allows you to view additional information after you have opened an alert. If you swipe left, it will bring you to the More Information screen. Depending on the type of alert, different information will be displayed on this screen. Within the Engage app, you have the ability to instantly communicate by way of secure messaging to one or more Osler employees. You may include patient information in these conversations because the app meets Osler's privacy and confidentiality policies. To locate an Osler staff member or group you would like to message, click on the plus sign in the main alert screen. You will then type the name of the Osler staff you want to message in the search bar. Once you have found the Ulster staff you want to message, click on their name. By clicking on the blue star, you can add this name to your favorites. If you want to start a secure text message, click on the blue bubble to start a conversation. If there's a phone icon, the staff member can be reached by clicking the icon and it will directly dial their phone number. All charge nurses are listed by their location, followed by the letters CN in the directory. Only Ulster staff who are listed as available can be reached through this app. This is a sample of what a secure message looks like. Below each message, there is a confirmation of when the message was read. No doctor's orders may be taken within the secure messaging app. There are new clinical isolation alerts being developed. An isolation alert will be sent to the charge nurse's device when an NP swab is collected. The ER charge nurse will be required to let the primary nurse know to start isolation precautions. Details about specific isolation precautions will be provided when the alert is opened. If you are having any issues with your device, please refer to your troubleshooting guide in your clinical alert binder. You may use the iPhone to make internal and external calls. Click on the phone icon in the bottom of the home screen. There is a contact book located beside the phone icon that will hold many of the unit's frequently used numbers. Any updates or additional new clinical alerts will be communicated by email. If there is a Meditech or Engage downtime, you will be notified on your device. You will need to access all downtime forms in your clinical alert binder. You may secure message myself through the Engage app for any questions about any clinical alerts. The Engage application enhances our current system and gives us the tools to help also provide optimal care for our patients.